So Sally, we're about to see Taylor. What do you know about her?
I know she's a 6-month-old. The doctors think she's developmentally delayed, so they want her to have a physio assessment.
Okay, and what's brought her into hospital?
She was brought into hospital for ED 4 days ago, I think. Failure to thrive.
Do you know what failure to thrive is?
The chart said she's lost weight and isn't feeding properly and that she's irritable.
And do the medical teams know why Taylor has had those symptoms yet?
No, I don't think so. She's still having more tests done, but doctors might think it's an allergy to cow's milk.
Were there any other important symptoms documented in Taylor's medical chart as to why Mum's brought her into ED?
I did read she had some diarrhea, coughing, runny nose and vomiting, coffee grounds, I think.
Do you know what coffee ground vomiting means?
No.
Well, it means blood in the vomit. In Taylor's case, it's most likely due to eosinophilic esophagitis, which is an inflammatory condition of the stomach and esophagus. That's why she's been started on the drug ranitidine, which helps to inhibit stomach acid production. It can also be confused with reflux disease.
Okay.
And can you tell me any more about Taylor's symptoms? Should we be worried about anything, or will it impact our assessment today?
I don't think so.
Could she be infectious with these symptoms?
She might be, but how would I know?
Well, she should have had some stool samples taken, so we could look at the pathology results. We would also be able to chat to the nurse, and it should be documented in her chart. Another thing we can look at, there'll be a sign on the door with the infection control procedures.
Okay.
Was there any other relevant history to do with Taylor's birth or antenatal history?
I don't remember reading anything that was important.
What about a general medical and social history?
Well, I was going to ask that stuff when I do the examination.
Okay, that's fine. When do you think will be a good time to see Taylor today?
I guess now if she's awake.
Is there anything else you need to take into account?
Maybe we could ask Mum to be there too.
That would be great. Anything else? What about her feeding schedule? Do you think that might affect our timing?
Well, I know she's been having tube feeds, but I can double check that.
You are right about the nasogastric feeds. She's having them overnight to help with weight gain. I'm pretty sure the tube came out early this morning, so we'll have to be recited later today. Taylor is on bottle feeds, so we'll have to make sure we time our assessments in regards to those. Do you know why?
I'm not sure.
Well, she'd be more likely to vomit if she's just had a feed. It's best if we time our treatment session in an hour or so prior to her next feed.
That makes sense.
So you mentioned that Taylor's been referred to physio for developmental assessment. What details would you like to gain most objective?
Well, I'd ask about Taylor's age, when she started doing like the things that she's doing. Maybe rolling and sitting and playing on her tummy. And I want to get a social history.
Sure. What would you expect to see in a typically developing baby?
Well, all the things I just said.
Is there anything else you might want to look at? Any other relevant systems to assess?
I want to make sure she hasn't got a flat head. So many babies have those. Oh, and I could have a feel of her arms and legs, see how they're moving. I'd also like to check her tone.
That's really good that you've identified her musculoskeletal systems, but it's good to have a look at her sensory systems, such as her visual and auditory responses. Also her early postural control, like pull to sit and weight bearing and standing. And also have a look at how her infant patterns of movement are integrating.
Okay, I'll have to check how to assess that.
Do you think you'll be able to do a full assessment today?
I think so.
Is there anything that you read from Taylor's chart that might limit this?
Well, she's a bit irritable and not sleeping. I'll see how I go. I'll try to be quick though so that she can have a rest afterwards, but I definitely want to see her moving in all those positions.
Okay, let's go see Cassie and Taylor then. I've popped into Mum early today and she's happy for us to do a student assessment.
Yeah, cool. Hi Cassie, I'm a physiotherapy student that's going to be seeing you today.
Oh, okay.
Oh, hello, I'm Jenny, the physiotherapist. We met earlier today.
Hi.
Sally, just want to wash your hands.
Oh. Cassie, the doctor asked us to come and see you today because Taylor's got a little bit of developmental delay.
Yeah, here I was only worried about her sleeping and her feeding, and I didn't even know there was anything else wrong with her.
Okay. Well, she's 6 months old now, so she should be doing quite a lot. Is there anything you've noticed that she is doing?
When she's in a good mood, she smiles and starts talking to me. She's sucking her hand a lot, and she likes kicking in the bath.
Is there anything else that she's doing at the moment?
She really likes sitting, so she's really settled if I hold her up like this all the time.
And is there anything she doesn't like doing at the moment?
Well, she's never liked being on her tummy, no matter what I try. And she's not really rolling yet, but I thought that was normal for her age.
And Cassie, do you have any other kids at home?
No, Taylor's my first baby.
Okay. And do you stay at home with her or?
Yeah, my husband Jack works full time, so I look after Taylor. She doesn't go to daycare or anything.
Okay. Well, let's have a little play with Taylor if she's up to it today. Is that okay?
Yeah, it should be okay.
Sally, what about washing your hands?
Oh, yep. Okay, Cassie. Well, we just want to have a little look at Taylor, a little bit of play with her on the bed. Is that okay?
Yeah, sure. She's a bit cranky and she might have a spew, but hopefully she's alright.
That's okay. So I'll just grab her.
Do you mind leaving her suit on? She's been scratching at her eczema.
Yeah, no, that's fine.
Okay.
Cassie, would you like to go on the other side where Taylor can see you?
Okay, yeah.
Thank you.
So I'm just going to go grab some toys.
I'll just step in next to Taylor.
Oh, yeah, sorry, I forgot. So we'll just start off by watching her tracking her eyes.
Sally, is that the most appropriate toy for Taylor?
Well, I have some more if I need to use a different one, but I think this one's okay for now.
Okay, I might go grab something else for you.
Oh, okay.
How about you try the mirror instead?
Oh, okay.
What else are we going to look at?
Maybe the tone in her legs.
Sure, did you want to look at any other positions first?
Yeah, we could try putting her on her tummy.
Okay. Got our arms clear there? Yeah, I'll just help you bring it forward.
She really doesn't like being on her tummy, does she, Cassie?
No, she gets really upset.
Okay. What else are you going to have a look at?
Maybe we could try putting her in sitting.
Okay.
Okay.
Next time, just roll over first. Alright. Cassie, do you want to have a nice cuddle with Taylor to settle her before we move on?
Okay, yeah.
There you go. Right, what are you going to have a look at next? Where should Mum pop her down?
Maybe we could have a look at her in sitting on Mum's lap and look at her clonus, or...
How about we pop her back on the bed?
Okay.
So you want her back down?
Yeah, yeah.
Just lying her facing us if that's okay. Thank you.
So, check her legs?
Sure.
It's okay.
Okay. Now, I'm just going to show you something if that's alright. We want to pop Taylor so she's nice and symmetrical and her head's in the midline. Did you have a look at her head before?
Oh, no. Yeah, I'll have a look at her head.
Okay. Do that now.
Is there something wrong with her head?
Oh, no, her head's fine. We'll just have a look at her legs as well.
Okay.
Okay, so nice
Her
and
legs are a
straight.
little bit stiff.
I'll just have a look as well. Right. It's okay. Do you want to have another feel? You see there's a bit of resistance when she's all in midline.
So what's wrong with her legs?
Cassie, Cassie, it's okay. Taylor's done a lot of extensor posturing with her abdominal discomfort, and that has reinforced some extensor movement patterns in her legs. This should settle down as she's more comfortable with her tummy.
Oh, okay, that's good.
Maybe we could try putting Taylor in some prone positions on the therapy ball.
Okay, that sounds good.
What if she keeps getting upset when we try that?
Well, we can get a toy and just distract her. And
Okay.
Cassie, would you like to take a seat?
Okay,
And
yeah.
Sally, would you want me to bring Taylor over to you?
yeah.
Should we come up? Hey. Ooh. There you go. Alright. There's your mum. Say hi.
Hey, Taylor.
You ready?
Mhm.
Hold it.
Mhm.
Got it?
Hey, darling.
How about you try sitting on it first to get used to it?
Yeah.
That's good. Hey. There's your mum. Maybe a bit taller. That's nice.
Hey, Taylor.
Alright. She looks pretty good there. Do you want to try her on her tummy?
Mhm.
Oh.
Wow, that's the best she's ever done. I don't have a ball at home though.
Oh, they're pretty cheap from department stores and stuff.
Okay, maybe Jack could try and find one on the weekend.
You could use a nice soft pillow instead. That way Taylor's still standing upright.
Okay, sure.
Do you want us to leave the ball here, Cassie, for you to have a go with later?
Oh, I've never sat on one of those myself. I'm not sure what to do.
Do you want to have a go?
Yeah, now? Okay.
Use your legs to hold the ball.
Okay.
Hold it too. Oh, that's
Just like that?
Yeah.
Oh, just bring your arms in front as well.
Okay.
Oh, that's lovely. Hello.
See, there you go, Cassie. Taylor will be better, doing better at tummy time in no time.
Okay, Sally. Did the session go as you expected?
Yeah, I think so. Taylor didn't really like being on her tummy, but we got there in the end.
Why don't you think Taylor likes going on her stomach?
Maybe because she hasn't practiced it enough?
It could be, but it's more likely due to her pain and also her feeding issues affecting her energy and strength. What were the main findings from your assessment?
Well, she is delayed in her motor skills, especially rolling in both directions and playing on her tummy. Even her back, she didn't really do much. Oh, and she also had increased muscle tone in her legs. Is that something that we need to worry about?
You have to remember that Taylor's done a lot of back arching, and this has reinforced some strong extensive movement patterns in her legs. We should see this settle down as she becomes more comfortable in her tummy.
Okay.
What would you expect to see if it was a neurological cause?
I don't know.
Well, we'd expect to see a velocity-dependent resistance to stretch in her legs. We may also see some clonus in her limbs as well.
Okay, that makes sense.
There were some other assessment items you talked about doing but didn't get to complete. Why was that so?
Well, we just kind of ran out of time, but I can assess them next time.
Do you have any particular assessment tools that you have in mind that you could look at Taylor's development?
I don't think so.
What about the aims?
I've heard of that, but I'm not really sure how to use it.
Okay. What are your ongoing plans for Taylor?
Well, I'll do the notes in a minute, so then you can check them. And then I can see her again this afternoon and show Cassie some more positions. We can try putting Taylor in those, and then we can come back as well tomorrow, maybe before they go home too.
Let's just remember that Taylor's not herself at the moment. We don't want to overload her or Cassie. Are there any other ways that we could make sure she's followed up?
Yeah, I could try putting her back into outpatient.
Do you know where they live?
I can't remember.
Okay, well, let's go and find that out, and then we can see if it's more appropriate to refer them to a local physiotherapy service.
Yeah, okay, that's a good idea.